KCBS News Time, 12:20. As KCBS has been reporting, the votes yay and nay are falling into place on health care reform. Speaker Pelosi has reportedly opted not to use the deem and pass House rule to vote on the bill, and instead her members will vote directly on the Senate measure. Democrats continue to announce whether or not they'll vote for health care reform, with Representative Jim Costa of the Central Valley now saying he's a yes. Earlier, we spoke with East Bay Democratic Congresswoman Barbara Lee, who supports health care reform. Now, for some Republican reaction, we're joined on the KCBS Newsline by California Congressman Darrell, who represents the state's 49th district in Southern California. Thanks for taking time out for what I know is a busy day to join us.
Oh, happy to. There's nothing more important than the health care debate.
That's right. Where's your money today? Is it going to pass or not?
Yeah, I believe it'll pass. I think it's been an inevitability that both the Speaker and the President have staked their reputation on this bill more or less as it is.
And what will your feelings be when it does pass? Are you a supporter?
No, there are no Republican supporters. I'm ideologically neutral on a lot of aspects of health care reform, but I'm passionately against this bill costing so much more money net. I'm a businessman turned elected official, and I just don't understand how if we spend twice as much as the Canadians, how any bill that actually increases the total cost is a good idea versus something that actually would address the fact that if we spend twice as much as Canadians, it's hard for us to compete in goods and services.
What kind of bill would you rather have seen before you?
Well, I certainly would have liked to have seen some of the aspects of this bill, a universal coverage, opportunity, recognizing that some can pay and some can't, getting rid of preconditions and portability. I certainly would have liked to have seen that. I actually authored a bill that gave everyone in America access to the same health care plan, literally, that members of Congress have, because I think it was a good solution. There are over 300 choices in that plan, and available in all 50 states, no age, pre-existing condition, or portability limitations, except you can only change once a year, which I think for most of us, changing health plans once a year is all we could take anyway.
Congresswoman Barbara Lee said this: if it passes, it would just be a start. Do you
I agree with
so?
Barbara Lee
Yeah.
that ultimately, because this bill is gimmicked and I don't mean to be pejorative, but it's gimmicked in that it only provides 6 years of benefit for 10 years of tax. It's very clear that as time goes on, they're going to have to figure out ways to actually address the rising cost, particularly in the government-funded portion, and they're going to eventually probably get to single payer. I've told my colleagues that ultimately, if we're going to be competitive against the rest of the world, we're going to have to drive down cost. If we get to single payer, then we'll start using the same techniques as Canada. If we don't get to single payer, we're still going to have to find some free market solutions that really do bring down costs.
So in that sense, do you think down the road there could be more agreement, more bipartisan agreement on what we ultimately end up with?
Well, I think it's going to be difficult. I think the stage is set. You might remember when Republicans gave seniors Medicare Part D. It wasn't very bipartisan. It was almost all Republicans, a few Democrats. And to this day, no one's changed Medicare Part D, but no one's willing to come in from the Democratic Party and embrace anything further on it. So I think to a certain extent, and I don't mean to be unfair to Barbara Lee or any of the other Bay Area Democrats, but they've broken it further. It was broken. They've broken it further. They're going to own it to a certain extent when it comes to it doing what government programs usually do, which is run dramatically over budget and ultimately make Washington look even more like Sacramento than it already does.
Now, when the GOP was in power with both houses of Congress and the White House, why wasn't there some sort of health care reform then?
Well, I can't speak for the Senate, but in the House, we passed tort reform, basically MICRA, as we have in California, out of the House either 2 or 3 different times. I remember 2 specific times we passed it, and it died in the Senate, even though Senator Feinstein supported a national MICRA-type reform. So trying to find tort reform, there were efforts. There was quite a bit attempted. But in fairness, I think that Republicans, to a certain extent, went the wrong way in adding Medicare Part D out of general tax revenue, not really coming to grips with the fact that Medicare more and more is a burden on every taxpayer. And as you know, it's over $15,000 for every single senior that's spent on Medicare, and Medicare still doesn't pay its fair share of reimbursement to hospitals, Bay Area hospitals, and physicians.
Thanks so much for being with us. We've been talking on the KCBS Newsline by Republican California Congressman Darrell Issa, who represents the state's 49th district in Southern California, who says he does think that the health care reform bill will pass. A vote is expected tomorrow.